Good afternoon, everybody. I just want to thank you for showing up and watching our little bit of a video. I want to talk to you today about what it takes to be healthy. I want to suggest to you that there are certain behaviors, activities, and choices that we have available to us that will help us to achieve optimal health. A number of years ago, I read a book by Dr. Dean Black. And in the book, he describes a concept that he called contextual healing. He suggests that there are certain contexts that are ideal when things are in their proper relationship, that are ideal for creating health, and that's all that the body is able to do. Is that it must create health. If you don't have those contextual things proper in proper relationship, then there's no way that it can create health. He sets this table by describing something in using analogy from another line of work, actually. He suggests that if we were to use a snow machine, and I'm talking about the snow machine that you use to make snow, not the kind of snow machine that a lot of people ride. Anyway, what he suggests is that in order to have a snow machine, something that makes snow, you have to be able to control a number of variables. And of course, one of the variables you'd have to be able to control is temperature. It's obvious as the nose on your face that if you don't have temperatures 32 and below, that you're not going to be able to create snow. You're just going to be blowing water through the lines and the hoses. That brings us to the second variable. We all know that snow is water, but it's water that has turned to icicles, if you will. And so if we don't have water in the tubes going out into the air, which is 32 degrees or below, all you're going to have is dry air. However, if you adjust the lever and bring a little bit of water into the hose and let it go through the pressurized nozzle and it goes out of the air, you're absolutely going to make snow. Without the proper temperature, you're going to move away from snow. Without the proper amount of water, you're going to move away from water. And we would agree that there are certain volumes of water that are necessary to make the best kind of snow. And if we looked at all the other variables that we might want to control, we might even consider barometric pressure or the particles in the air that the water condenses on, in the wind, and so on. And so we could make slushy snow and really wet and heavy snow, and we could make sleet, and we could make fine granular snow. In ideal situation, we could make this beautiful powdery, shiny, glistening snow like we just had yesterday. So here, let's think about it though in terms of health. So we're not making a snow machine, we've got a health machine. In order to create health, we're going to have to be able to control a few variables. The first variable, and not in any particular order, but one of the first variables that we're going to have to be able to address is we're going to have to make sure that we are eating the right foods. It's really an axiom of health that if you want to be a high-performance human being, you've got to eat high-performance foods. Certainly, your body can take almost any kind of crap that you would take in. It can take a Hostess Ho-Ho, and it can take the calories in that Hostess Ho-Ho, and it can actually use it to make energy, but it isn't going to use it to make perfectly replicating tissues that will keep you young and strong and fast and agile and flexible, and at your ideal weight. It's not going to do that. So there are a number of things that people call food that we eat, but really food is stuff that grows out of the ground. And we eat it fresh and grows off of trees. And protein is stuff that is naturally occurring. And those are the kind of things that we want to eat in the right balances. As unprocessed as possible, as uncooked as possible, we want to eat these foods. And if we eat those foods, they will build into us the tissues, the components of the tissues that are necessary for us to be strong and fast and agile and youthful looking and keep our ideal weight. So proper food is important. It will improve our healing process. The second thing we need to do to address is exercise. There's an axiom, if you don't use it, you lose it. And we all have recognized this. And it's so important because exercise, not only does it build our muscles and improve our cardiovascular fitness and our capacity and keeps us healthy, but regular strenuous exercise causes our body to produce more human growth hormone and more testosterone. And if we do this our whole lives, we'll produce more of this throughout our lives. We've all noticed by now, or those of us who've reached that age, noticed that after age 30, it was a little harder to cut weight. It was a little harder to build muscle. It was a little harder to maintain the number of pull-ups or push-ups that we used to do. Because when at age 30, our body naturally drops the production of human growth hormone and testosterone. And when it does that, it doesn't have the ability to replicate itself so well. So if we want to replicate ourselves, in as perfect a fashion as possible, we need to have regular, strenuous, cardiovascular strength exercises. Those hormones also cause you to heal faster. You'll heal from a cut, you'll heal from a broken bone, you'll heal from a sprained ankle. All of those things are important. Okay? Our body is innately made to heal itself. And we can do certain things that will help the body's innate intelligence do that at a much more reliable and a more optimal level. If we neglect these things, if we neglect what we eat, and we neglect our exercise program, our body will begin to deteriorate at a faster rate. And getting back our health will be that much more difficult. Another thing that's really, really important for us to remain healthy is we need to get enough rest. We absolutely have to get enough sleep every day so that our body is able to do what it's supposed to do. So that we de-stress, that our body repairs during sleep. It recovers during our sleep. And so I'm a big proponent of sleeping 6 to 8 hours a night. And if you're able to, if your lifestyle, your job lets you, then you should also try to take a 15 to 20 minute nap every single day. The third thing that is really important is positive mental attitude. I talk about this a lot and more in depth in my office with patients and when I do a Life You Save workshop. But positive mental attitude is incredibly important. We know that what we think influences our outcomes. We know that when we write down our goals, that we're more likely to achieve those goals. We know that if we have a positive mental attitude, we tend to respond better to crises. If we have kind of an Eeyore attitude, we tend to respond poorly to crises. And it causes certain hormones in our brain to lead to depression and anxiety and so forth. Another thing that's important, I share this also in my class, that the brain's a powerful thing. There's evidence in the literature that people with multiple personality disorder, in one personality, they might have sort of normal, what we consider normal physiology with regard to how their body works. But in another personality, they might become insulin dependent. And they might be insulin dependent for a few days or a few hours or a few weeks as long as they're in this personality. But when they change back to the other personality, we find that they don't need insulin again. Crazy, isn't it? But the difference is really what's going on between the ears. So if that's true, then we need to access that. And I talk to people regularly about the placebo effect. We understand that the placebo works 28, almost 30% of the time. So when they're testing drugs, on the one hand, they always test it against a placebo. And so if they're testing cancer medication or whatever, about 28% of the time, the sugar pill works for this person who's got the real symptoms of cancer or whatever. And on the other hand, the drug works, if it's effective, it works better than the placebo. So what makes the sugar pill work for a cancer person? Something about the expectation. So what I want to tell you is that when you are addressing your health concerns, that you have a higher expectation, that you begin to affirm to yourself that you're going to be a healthy individual. That the treatment plan that you have opted to buy into, whether you're going to a dentist or the oncologist for your cancer or to a chiropractor, whoever you would go to, I'm going to recommend that you have this positive expectation that you are going to respond to the care that's being offered to you. You're going to respond to the new behaviors that you're going to adapt and make a part of your lifestyle. And that response is going to favor you and produce more health. Expect that. Lastly, that I want to talk about is really the crux of the matter for a chiropractor. Essentially, what we do is we take care of the nervous system. We work with the spinal column, and a lot of people think that we're back doctors because we work with this. But we're no more back doctors than a medical doctor is a mouth doctor. Why do I say that? Well, the doctor, or the medical doctor who prescribes medication for you and gives it to you, he puts the treatment in your mouth, or you put the treatment in your mouth. But you don't think of him as a mouth doctor. You just see him as putting the medication in, and once it goes in, it dissolves into your bloodstream, gets into your hormonal system, that it's going to have some beneficial effect to help you address the symptoms that you're suffering. So he's not a mouth doctor, he's a whole body doctor. A chiropractor is not a back doctor, we're a whole body doctor. But rather than accessing your mouth, we're accessing your nervous system. And we do that through the vertebral column. Because what we know is that it only takes 43 millimeters of mercury pressure. At 43 millimeters of mercury pressure, if we could make that the equivalent of something we all handle every day, it's about the weight of a dime. It only takes about the weight of a dime to cause a nerve system, or the nerve that it's leaning against, if you will. It takes about the weight of a dime, that equivalent amount of pressure, to cause the nerve that it's touching to function at less than 50%. So if that nerve is going to your heart, it's functioning less than 50%, it can cause heart disease, irregular heart, your fast heart, too slow of a heart rate. It could change your blood pressure, it could change your respiration rate, it could change, if it's going to your digestion, it could affect how you digest, it can affect your elimination. So chiropractic is really addressing the nervous system. And it's an essential thing for us to address. If you're going to make snow in your life, you're going to have to be able to address the water, and you're going to have to be able to address the air temperature and the barometric pressure. If you're going to make ideal snow, you're going to have to be able to handle all these things, and so you have this beautiful glistening snow. And if you're going to have a beautiful glistening life, if you're going to be the person that you were designed to be, if you're going to express what your DNA has in store for you so that you can be absolutely healthy, you're going to have to address eating right, getting enough exercise, getting enough rest, having the mindset that health will come to you if you work these levers. And the last thing is you absolutely must take care of your nervous system. I want to thank you. I'm looking forward to seeing you again soon. Dr. Charles Foster with Fostering Wellness.